How did our outbreak get so bad so quickly? We now know coronavirus didn't gain a fragile toehold in the UK before spreading. It came here in a relentless surge of cases linked to travel to our nearest neighbours, weeks before we brought in lockdown.
Yeah, the idea of patient zero is not a good one, not just because it's a stigmatizing idea, but because it doesn't reflect how cases are transmitted in the UK. Very large number of separate introductions.
The analysis is based on the genetics of individual viruses from individual cases. These machines at the Sanger Centre in Cambridge are part of the UK-wide collaboration to sequence thousands of them. Coronavirus mutates over time, allowing the researchers to build a family tree. Each virus, each infection has its branch and its own story. The virus began its life in China and began to spread, mutating as it went. By comparing the genetics of more than 25,000 UK cases with travel data, they found the majority of cases came to the UK from Spain, nearly a third from France, and 14% from Italy. In all, they estimate the virus was introduced here more than 1,300 times. Cases started arriving when our focus was still on China, when in fact people returning from our nearest neighbours were seeding new clusters across Britain, 80% arriving in the month before lockdown.
It would have been very difficult to work out how to shut the borders with one country and not another, given the evidence that was available at that time. We certainly wouldn't have expected in the middle of February that the major risk might come from our closest neighbours in France, Spain and Italy, as these data are now suggesting. So I think the only way that one could have thought about that is a complete isolation. That would have been a very drastic measure to take at such an early stage of the epidemic.
But the real potential of COVID-19 genomes could be yet to come, combining what we've learnt about the virus's family tree with a test and trace system.
It's a very powerful tool for chasing down the remaining sets of transmission chains, and also for when we were now very fast at detecting new chains of transmission, so we're going to be very good at detecting new importations.
With the chance of a second wave of infection still very real, knowing the genetic history of each virus could become a lifesaver. Tom Clark, News at 10.